Hi, it's Dr. Matt Harkness with Allied Physical Therapy Wellness Community. Well, I'm so glad you joined us for our Wellness Connection video. In this segment, we are talking about what is a physical therapist. A lot of people ask, what is a physical therapist? Are you a doctor? Are you not a doctor? Are you a real doctor? What are you? So let's talk about the education level of a physical therapist. It is a doctorate degree. It's a 3-year, usually plus or minus a few years depending on the program, but generally speaking, it's a 3-year doctorate of physical therapy degree. And just like you have, say, a doctor of optometry, a doctor of pharmacy, you have a medical doctor, we are specifically trained and specialize in movement, and it is a doctorate degree. So we are called Dr. Matthew Harkness. So also, the education is more encompassing of all the systems, anatomy and physiology, bones and muscles, your nervous system, cardiovascular system. So it's a very robust didactic requirement to become a physical therapist. And of course, we have a board exam that we take, and we are in major hospitals. We're covered by insurance, and we are an important part of the medical family of practitioners. And I always like to say we're kind of the dentist of movement, for a simple phrase. So what does a physical therapist do? So first, when a patient comes in, we evaluate and determine, what is the limitation they're having. Usually it's something to do with movement, maybe walking, maybe reaching, maybe they've had surgery and they're getting the joint moving again. So what we do is we listen to the patient, determine what are their goals, what were their limitations before this injury or acute onset, and where do they want to get. So in that assessment, we do objective measurements. We may use tools to get and see how much motion there is. This is called the goniometer, and we determine how much elbow flexion, how much are they able to bend it. We record that number here. We also look at, perhaps, if there's swelling in the joint, and we look at the measurement around the joint to see how much swelling there is and compare it to the other side. And of course, the goal would be to reduce that swelling. We also may check for sensation, sensory, reflexes. We look at strength. And then we build a treatment plan. And so for treatment, we use several different techniques. Just like doctors, you can specialize in different areas. So a couple of the specialties we have here at Allied Physical Therapy is, one is the treatment of the head, neck, and jaw, or a craniofacial specialist. And then we also have our pelvic health, our pelvic floor specialist. That's Melissa, Dr. Melissa, my wife, and her team. And those are subspecialties within physical therapy where you get your doctorate degree and then you go on and do another couple of years of training to get a certification or a fellowship or some sort of specialty like pelvic floor and craniofacial pain or dysfunction. So for treatment, we use some different tools. One thing we do, if there's restriction in the soft tissue after you have an injury, we may use some cupping techniques to help to lift the skin away from the muscle and restore blood flow to the area to allow for good movement. Let's see, we also may do some what we call dry needling, where we take needles and we put them in what's called the trigger points, and we may wind them to help to reduce and break that trigger point cycle so that the muscle can relax. Sometimes if you have knots in your neck, these dry needles work very well for getting the knots out or the trigger points out to restore flexibility and movement. We use some different topical creams. We do a lot of hands-on work, loosening up the tightness of the muscles. This is a full spectrum CBD product that we use. We may use some BioFreeze or some sort of similar product to help relieve acute pain. This has a nice cooling sensation, kind of relieves that sensation of pain. It works very well. Then we may do some strengthening, different strengthening techniques to restore strength of a weak muscle. These are different types of resistance that we apply to help to get strength back to an area. Also, a common tool we use is a gait belt. We put this around if we're doing balance training or something and you're unsteady. We put the gait belt around and just kind of have our hand lightly on there. Just in case you were to lose balance, we can be sure to catch you that you won't fall. Also, this is a common thing that you've seen now. It's pretty widely in the market now, but this is called a Theragun. And this has a different tips to help loosen up the muscles. Works very well. So this is something we use a lot as well. Of course, these are only a few of the tools that we use, but we also have an important team that works with us. One of the team members is we have physical therapy assistants, just like the physician has a physician's assistant. So the difference is our training is longer. Theirs is about half the length of ours. They're trained in more following the plan that the doctor of physical therapy generates or makes. They're very skilled at administering proper procedures, exercises, soft tissue work, balance training. And they consult with us if there's a change in the condition of the patient that we need to come in and assess and determine if there's a different plan that is needed or something needs to be added. Also, we have what we call here our wellness guides, and these team members are aspiring to become doctors of physical therapy. A lot of them have finished a bachelor's degree in, say, movement science, exercise science, and they are assisting the flow of treatment of the clinic. And so they, of course, are prepping the rooms, keeping the flow going, calling the patients back. If they have interest in purchasing any supplies, they handle that. They may assist on some exercises and making sure that you're doing them correctly. Or if you need any equipment, they'll provide equipment for you. So they are an essential part of the treatment process as well. And then, of course, we have the front desk and the schedulers and the experts on insurance and billing. And they are in the front, and they play a very important role to make sure that your schedule is clear, you've got them all booked out. They send reminders, they do reminder phone calls. They have any questions about the billing and the finances, they handle that. So it's definitely a team effort. So what is the difference between us and, say, a massage therapist or a chiropractor or maybe an athletic trainer? There are, first and foremost, many similarities. Massage therapy, they are not trained in treating pathology so much. They have a shorter didactic portion, and they're not in hospitals. And chiropractors, I have a good friend in town, Dr. Omar Smith. He's very good, and of course other doctors of chiropractic in town, and we collaborate together. They do probably a bit more manipulation than we do. They're looking at alignment. We're looking at more what we would call movement dysfunction. So, they are not in hospitals so much. Insurance does cover them, but We are more in, the mainstream medical model. So, but, there are great massage therapists, great chiropractors, and so, the best thing is we all work together. Now we're going to talk about who can benefit from physical therapy. Now consider your dentist. Who can benefit from a dentist? Everybody should have a dentist. The same with a doctor of physical therapy. Everyone should have a doctor of physical therapy that they trust and they see on a regular basis. So what are the common types of conditions we see? Well, sciatica, back pain, joint pain, shoulder pain, elbow pain, headaches, migraine headaches, tension headaches, balance dysfunction. You've had a fall and you need to improve your balance so you don't fall. Within our specialties, say pelvic health would be incontinence, bowel or bladder incontinence, frequency, you're going to the bathroom and getting up several times a night. With the craniofacial specialty, it could be TMJ point pain, limited opening of the jaw, popping and clicking that's very painful, difficulty eating more firm foods. So all of you should have a doctor of physical therapy. And remember, one of the unique advantages of having a physical therapist is we do spend more time with you than most practitioners. So it gives us a chance to really uncover the layers of how we can help you best, what are the limiting factors, and making sure that you develop key behaviors to continue on after you finish a duration of treatment with us. And of course, after you finish, it's very important to come in for what we call a wellness visit. You're coming in once a year just to make sure you're not drifting off course and there's some areas that you feel that you're fine, but actually you're vulnerable to re-injury. So an important factor to consider with physical therapy is studies have shown that physical therapy is actually a lot less expensive than, say, surgery or some sort of more invasive procedure. And the reason being is because with physical therapy, a lot of times we are able to help you slowly get better and adapt with your limitations to continue to work. Say if you have surgery, you might be in a sling or you might, be at home and you're not able to continue to work to earn an income. Oftentimes too, we are able to conservatively manage and get you back by some skilled treatment as an alternative to, say, having surgery. Of course, surgery sometimes is necessary, and I'm thankful for great surgeons out there, but you should always try physical therapy first before you go into the operating room. Another thing you want to consider is risk of, say, other things like medications, more narcotics or stronger medications that could be risky for perhaps developing an addictive behavior. Once again, medications are important and they play an important role, but if we rely on them too much, they have some negative consequences as well. Okay, so you're ready. You say, hey, I need some help. I want to come to physical therapy. How do I do this? Well, it's as simple as 1, 2, 3. So the first thing you would do is give us a call or go on a website and you can fill out the section that you want to schedule an appointment. Just give us a brief overview of what's going on and then we will get you scheduled. Now, according to state law, you do not need a referral to come to physical therapy. You can just pick up the phone, come in and see us. But some insurances do require a referral from your medical doctor. So our team of experts, of course, they know exactly when you need a referral, when you don't need a referral, and they will help you with that. They can also help you with questions about does my insurance cover it? Do I have a copay? I don't have insurance. What are my options in terms of paying cash? Can I use Care Credit, which is something that we offer so that you don't have to pay all at once. You can pay for a period of time without interest. So there are a lot of options, but don't delay. Simply pick up the phone, go online, schedule an appointment, and we will get you going quickly and smoothly, and we look forward to seeing you here at the clinic. So, once again, like your dentist you see twice a year, you really need to be seeing your physical therapist, certainly when there's a problem, just like you have a toothache, you go to the dentist, but also on a regular basis, once or twice a year, just to make sure you're staying on track. Again, a key benefit is the approach, whole person approach, body, mind, and spirit, getting more time with us, with our team, and learning these new behaviors and changing your mindset and rediscovering your purpose and identity in your current stage of life. Remember to visit our website, alliedpt.com. There are a lot of great free resources, ebooks, testimonials, videos, downloadable resources, so be sure to go there. Share this video with a friend, subscribe to our YouTube page. Our Facebook and Instagram are active. Those are good places to connect as well. As a wellness community, it is so important that we're staying connected even when you're not here having treatment or you finish for a season. Let's stay connected through these digital media forums. So thanks for watching, and we look forward to seeing you next time.